I come to the floor to join my colleagues this morning to talk about the rising cost of health care and the impacts on small business. And I want to thank the chair of the Small Business Committee, Senator Landrieu, the senator from Louisiana, because she has been outspoken and an articulate advocate for small businesses. She is constantly focusing on what we are going to do to help small businesses in America, and she wants to make sure that any health care legislation that is passed out of the United States Senate focuses on that. And that's very important because we know that when we talk about small businesses in this current environment, they are currently at a disadvantage when it comes to our healthcare system. That is to say that they have long been the backbone of the American economy. Small businesses employ about 40% of our workforce, and even in a downturn, the job creation that we're going to see is going to come from small businesses. So if we can address their concerns in healthcare reform about the rising cost of healthcare, then we're going to be doing all of ourselves a favor because they're going to be able to grow more jobs and grow our economy. So I certainly applaud the senator from Louisiana for her efforts and join with my colleagues, Senator Warner and Udall and Shaheen, in coming down here to try to describe why we think it's so important that we get health care reform and that we do something about this, because we really do want to get our economy going, and we certainly want to control costs so that small businesses can grow jobs. Well, why is this so important? Well, we know that we have seen a 120% increase in premiums over the last 10 years. That is to say, from 1999 to 2009, premiums of insurance have increased 120%. 120%. What family in America can sustain the constant increase in insurance premiums every year? In fact, the fact of the matter is they can't. In my state, we've seen a sharp rise in those who are without health insurance because the premiums keep going up. More and more small businesses have to make choices between keeping employees on the rolls or cutting back on their health insurance, and they're making those choices. And so it puts all of us at a disadvantage. So what should we be doing instead about the rising cost of premiums in health care? Well, we should be doing something to bend the cost curve. And you'll hear many of my colleagues, as you did this morning, talk about bending the cost curve and why it's so important. Well, right now, if you look at what's happening with health insurance, and as I said, it already increased 120% over 10 years. The next 10-year period, it's supposed to increase in the same kind of way, double in cost, increase about 7.9 to 8% a year. So that means if we do nothing, small businesses are going to continue to see this escalator of cost keep going up for health insurance. And that means they're going to employ fewer and fewer people because they can't afford the health care coverage. And we see that general inflation is about 2%, but this increase in premiums is about 7 to 8%. So why are we seeing this huge increase in the cost of premiums if general inflation is only about 2%? This, in my opinion, is what the healthcare debate should be about. This difference between general inflation and healthcare cost increases should be the entire debate. What are we going to do to drive down the costs so that healthcare costs are kept more in pace with inflation? Now, why are these statistics so important and so important? Well, the issue is that according to the National Small Business Association, only 38% of small businesses provided health insurance last year. That is down 61% from 1993. So you're continuing to see that shrinkage in people offering coverage. And of those who do offer coverage, 72% say they are struggling to continue to offer coverage to their employees. A MIT study shows that the cost of health care to small business will more than double in the next 10 years, just as it has before in the last 10 years, and that small businesses pay up to 18% more than the same coverage for larger firms. And so what that means is that small businesses are being disadvantaged. They're being disadvantaged because they don't have the same clout in the marketplace as a large employer to negotiate benefits and drive down costs. So what do we want to do about that? Well, what we want to do is give small businesses the same kind of negotiating power that large companies have to negotiate for benefits. In fact, healthcare reform and helping small businesses should be able to negotiate with insurance companies to drive down the cost of their plans. Now, this is something that is already part of the underlying bill that we passed out of finance. I'm sure when we see legislation coming to the Senate floor this Friday, we'll see the same kind of provisions, at least with the basic health plan, a provision that I helped co-author in the legislation that would allow states to negotiate on behalf of the uninsured, allowing those who are employed in small businesses or small businesses to help lower the costs. In our state, this plan has driven costs down 30 to 40% lower than what those individuals would be able to get in an individual market. That's amazing. The fact that they've been able to pool together 40 to 60,000 people, go to the marketplace and say to insurance providers, you want access to our insurance business, you have to give us a discount. I call it the Costco model. I don't know how many people here this morning understand the Costco model, but the Costco model is something where you buy in bulk and you buy large purchases. You should get a discount. And that's what we're saying. We want to give small business the same kind of purchasing power that large businesses have so that they can drive down costs. And that is going to be a critical component of this legislation. And this senator, along with my colleagues that were out here on the floor today, we are going to make sure that that negotiating power exists in a final bill for small business. Second, we need to make sure that we also have provider reform, that provider payments reward not just volume, but value. And right now, in our healthcare delivery system, there's a lot of focus given to the what I would say the quantity of healthcare that's delivered, the fee-for-service system that basically ends up having insurers basically paying physicians for the number of patients they've seen or the number of tests they've ordered, but isn't generated or focused on the payment to physicians based on the outcome of the patient. And so there are provider reforms in this legislation that will also help drive down the cost to small businesses because those providers will be focusing on what it takes to deliver health care to those individuals. And third, we need to have better transparency on drug pricing because transparency of cost is something that will help us in negotiating as a government purchaser of health care, negotiate better benefits. Right now there's a lot of unknown about healthcare costs and drug pricing because middlemen basically negotiate discounts on behalf of their customers but end up pocketing some of those benefits. So we want to make sure that all three of these things are part of vital legislation to help drive down the costs for small business. Now, I know I've had many small businesses come into my office and I've met with in the state of Washington. We're very proud of the diverse array of companies that exist in our state. A lot of people look at some of the major employers like Boeing or Microsoft or as I mentioned, Costco or some of the other Starbucks. But Washington State is home to many, many entrepreneurs. Many great companies that may even be the big companies of the future, but are the small businesses today, and they need our help and assistance. Two of those, Kent and Linda Davis, who run a technology company, and their consulting firm pays $1,500 per month for health insurance, $1,500 per month. And they just learned that in 2010, their premiums will increase by another $300 per month. And this is the third substantial increase that they've had in a row. So they want to hire more employees, but they can't because of the cost of health care. Another successful entrepreneur who's come into my office, Jeanne Otto, who is the owner of the San Francisco Street Bakery. Now, you might think that the San Francisco Street Bakery is in San Francisco, but it's actually in Olympia, Washington, and it employs 20 people. And over the past decade, the increases in health insurance premiums have forced them to take dramatic reductions in the level of benefits and the number of employees that they can cover. Now, this is a company that wants to grow. They want to expand. They have great products and great services, but it's the people like the Davises and like Gene Otto who are the economic engine of our economy. And they are going to continue to depend on us to make sure that in this legislation and this legislative debate, we're going to do everything we can to help small businesses grow. Well, Mr. President, small businesses can't grow if healthcare costs are going to rise 8 to 10% a year. It will hamper the ability of those small businesses to meet the demands and challenges of their workforce and keeping them healthy and facing an economy that has been certainly challenged by this big downturn we've seen, but needs to go back to growth in the future. So they want to be part of that. They want to be part of that growth, and they want to be part of helping our economy recover. But to do that, we are going to have to do something to control healthcare costs. And so I applaud my colleagues who I know share these same issues and concerns. The senator from Virginia, who has been very outspoken on the fact that we have to change our system to make sure that we are bending the cost curve and focusing on driving down costs with provider reforms. My colleague from Louisiana, who's focused on making sure that small businesses have the clout and access to small business negotiations that large companies have. And my colleague, Senator Shaheen, who also has been a big supporter of making sure that we have provider reform in the system. And Senator Udall, who comes from a state that knows that healthcare costs are a key component. If we want our economy to grow, that we have to drive down healthcare costs. So, Mr. President, I see two of our former colleagues who've been on the floor in the last few minutes, the Vice President of the United States and the Secretary of Interior, and we're glad that they have come up to Capitol Hill to be in continued discussion with us about how important this legislation is. I want to thank them for that. I want to thank them for their service to our country and for their willingness to serve in the administration. We certainly miss them here in the United States Senate. But I think it emphasizes the urgency to the health care legislation, that our economy is struggling, that we want it to grow, that we think small businesses are going to be a key component of that, but we have to give them negotiating power. We have to give them the ability to negotiate with insurance plans to drive down the cost, and we have to do better at reforming this system so that we can see that growth happen in America.